Margaret Lou Moore Konefal Gallagher, Ph.D., a prominent figure in healthcare consulting, nursing, and mental health advocacy, gravitated toward her career path at a young age. Her father, Dr. James Moore, was a successful physician and military officer who rose through the ranks in the medical corps, serving as an early mentor to her, while her mother was an active volunteer all her life. Looking to them as role models, Dr. Gallagher knew early on that she wanted to dedicate herself to helping others and making a difference through a career in medicine. After a few years studying at Duke University, Dr. Gallagher earned a Bachelor of Science in Nursing from Incarnate Word College in San Antonio, Texas, in 1961. She furthered her education with a Master of Science in Nursing from Catholic University of America in 1969, and would later complete it by obtaining a Doctor of Philosophy in Urban Studies from Old Dominion University in 1991. Upon graduating with her master's degree, Dr. Gallagher became a clinical nurse consultant and clinical coordinator of newborn services at the Children's National Medical Center in Washington, D.C., where she worked from 1972 to 1977. In this capacity, she was instrumental in the development of a neonatal transport program and implemented the neonatal ICU component of primary nursing. She followed up this appointment with her role as manager of the neonatal ICU, followed by promotions to Associate Director of Nursing at the Children's Hospital of the King's Daughters in Virginia from 1977 to 1982, before switching gears and becoming an assistant professor at Norfolk State University from 1982 to 1991. In the early 1990s, she served as Director of Critical Care Nursing at what is now Nationwide Children's Hospital in Columbus, Ohio, while also teaching as part of the adjunct faculty at Ohio State University. Between 1994 and 1999, she was Nursing Director of the Pediatric Department at Memorial Children's Hospital in Savannah, Georgia, and assumed additional duties in clinical education and performance development at Memorial Healthcare Systems. Her next appointment was Administrative Director of the Child and Adolescent Center at the University of Texas MD Anderson Cancer Center in Houston, Texas, where she established a successful family-centered program. Within her many nursing administration roles, Dr. Gallagher continually fostered leadership development and advocacy skills among young nurses and nurse leaders, many of whom went on to accomplish great things in their own careers. She always told her staff of nurses that the profession gives us an opportunity to help make a difference in people's lives and to develop aspects of yourself needed to reach out and serve others. She also pushed and expanded the effective Resource Mothers program, which began in Virginia in the mid-1980s as an initiative to train neighborhood women to support pregnant teenagers and help them become strong parents. With her help, this type of program was established in numerous other states. In addition to program development, Dr. Gallagher was involved with major hospital construction projects in Washington, D.C. and Houston, Texas. Dr. Gallagher found success in the roles of senior manager and healthcare industry leader at Internal Audit Services within Ernst & Young LLP from 1999 to 2000. Between 2000 and 2008, she advanced from the Director of Women and Infant Services to Associate Chief Nursing Officer at Ben Taub General Hospital. She subsequently excelled as an adjunct professor at Texas Women's University and principal of Margaret Gallagher and Associates Healthcare Consulting, from which she retired in 2012. She currently teaches at NAMI Homefront, supporting family members of military personnel and veterans experiencing mental health concerns. Outside of her primary endeavors, Dr. Gallagher has been an active volunteer over the course of her career, contributing to March of Dimes, American Red Cross, the National Alliance on Mental Illness, and the National Association on Mental Illness, Greater Houston. Additionally, she has maintained her prominence in the field through her publications and affiliations with numerous professional organizations over many decades, including the American Nurses Association, American College of Healthcare Executives, Houston Organization of Nurse Executives, and National Association of Neonatal Nurses. She has also been a member of the National Perinatal Association, Association for Women's Health, Obstetric and Neonatal Nurses, and Texas Forum on Health Safety. Driven by compassion for others, Dr. Gallagher hopes to be remembered by her peers as a caring leader and creative problem solver. Looking toward professionals of the future, she encourages those entering the medical field to be patient and persistent, as in this way, things will work out over time. Dr. Gallagher, who has 5 children, 5 stepchildren, 7 grandchildren, 6 step-grandchildren, and 5 great-grandchildren, enjoys genealogy, gardening, reading, and volunteering in her spare time.